everyone, and welcome to the 2022 VHA Shark Tank competition. I'm Blaine Fitzgerald, and this is my best chum and co-host, Danielle Hagen. We are diffusion specialists from Diffusion of Excellence, and your host for today's competition.
Pleasure to join you today, Blaine. I'm excited to take a bite out of innovation.
Wait, what is that? Who forgot to silence their phone? This is a live event, people.
Blaine, I think that's your phone.
Oh, who could this be?
Blaine? Danielle? Hey, what's up?
Eric, is that you? Where are you?
I'm currently floating down the Potomac River, which is actually quite nasty. I don't know why anybody would. But anyway, that's where I am. What are you up to? Haven't heard from you guys in a while.
What a load of carp. I thought for sure you'd be here for your favorite IEX event, the VHA Shark Tank competition.
We have to get you here, Eric. We're sending in the Hammerhead to bring you in.
Girl, y'all IEX people worked me like a SeaWorld dolphin this week, and I was gonna skip y'all's little competition. But if you sent the Hammerhead, I'll look out for it and be ready to go.
Our producers will work their magic to get Eric back on the fish market. And now, let's get back to hearing us introduce this year's VHA Shark Tank competition.
Come on, Danielle. What's with all these puns?
Well, Blaine, I could reel it in, or I could just give fair warning to our audience at home. Things will definitely get very punny this year. Well, folks, I am happy as a clam to take you on a deep dive into the pre-Shark Tank events. Earlier this year, Diffusion of Excellence reeled in a whopping 286 applications. After careful review, our team of evaluators narrowed it down to 15 finalists.
Holy moly, Danielle. Looks like we have 14 of our finalists here for our 8th competition, ready to go. What's the deal with the bidding sharks?
Great question, Blaine. Our team scoured the VHA seas for medical center directors and regional leaders to be sharks. In total, they submitted 29 bids in hopes of winning the opportunity to implement these innovative practices at their facility.
That hard work is about to pay off. 10 of our finalists today will receive a promising practice designation and choose one shark bid to implement their practice at that new facility. What happens to the finalists who don't become promising practices?
Well, Blaine, everyone is a winner today. Even if a finalist does not become a promising practice, the audience can reach out to finalists directly on Diffusion Marketplace to work with them after the competition.
That's awesome. I also heard that today's audience gets to vote for their favorite finalist. The practice with the most votes gets huge bragging rights as our pitch of the day.
You're spot on, Blaine. The polls are open now. Use the QR code on screen to vote for the pitch of the day. Voting closes after the last finalist pitches, so pay attention and get ready to vote.
You ready, Danielle, to get today's panel of sharks teed up? It looks like these sharks are representatives here on behalf of all bidding sharks and will help guide our finalists through some difficult decisions today.
Excellent observation, Blaine. Your description really knocked it out of the park. Ocean.
Good afternoon, sharks, and welcome to the VHA Shark Tank competition. Our first shark is Bryn Cole, a designer, facilitator, and storyteller with VHA Innovation Ecosystem. Bryn has a sharp tooth for innovation, and once she bites down, she never lets go.
Next up, always in tuna with the motion of the innovation ocean, is Leandro da Silva, Acting Director, VA New England Center for Innovation Excellence.
And finally, the director swimming in all the way from VA Eastern Colorado Healthcare System, Michael Kilmer. He's got the gills for thrills.
Right here.
All right, Danielle, that's our lineup for today.
Wow, Blaine, I bet our audience is really chomping at the bit to see these finalist pitches.
Danielle, It's champing, not chomping.
Calm down, Fitzgerald. Although this panel may be full of champions, sharks are chompers for sure.
Digging deep with that one, Hagen. I love it. And now,
Let's get ready to rumble! Our first finalist today is Dr. Deirdre Quinn from VA Pittsburgh Healthcare System, presenting Contraception on Demand.
Imagine that you're in a waiting room with a group of very excited people. You overhear, "It was like having a pocket pharmacist for your womanly needs." "I know," says another voice. "This was much better than my previous experiences at VA." Then a voice chimes in from the desk, "And it helped make us better, more well-rounded pharmacists." You can't help but wonder, what amazing service are they talking about? Lucky for you, I have the answer. It's Contraception on Demand, a new pharmacy protocol that can revolutionize contraceptive prescribing in VA. At any given time, 90% of veterans who could get pregnant say they'd like to avoid pregnancy right now. We know that consistent contraceptive use is the best way to avoid undesired pregnancy. The problem is, access issues and refill delays get in the way of consistent use. 64% of women veterans had a gap in their contraceptive coverage that lasted a week or more in the past year, and those gaps can lead to undesired pregnancies. Evidence from around the US has shown that when trained pharmacists provide contraception, more people have access without barriers and without delays. Lucky for us in VA, we already have a highly skilled and motivated pharmacy workforce. Through the Contraception on Demand program, primary care clinical pharmacists were trained to provide patient-centered contraceptive counseling. Then, in a 30-minute visit, they review a veteran's medical and medication history and their preferences for contraception. And if it's right, they can order it on the spot, up to 12 months at one time. You already heard that veterans loved the care they received, and pharmacists loved providing it. And it turns out primary care docs loved it too, because it freed up time for them to talk to veterans about other health concerns. So Contraception on Demand is easy to implement, and it won't cost you very much. What are you waiting for? Here's how we make it happen. Our team can offer you an implementation toolkit, which includes training materials, templates, a marketing strategy, and a timeline, consultations with our team to make it work best at your site, and ongoing support for data collection to help you see just how many veterans' lives you're changing with this program. From you, we need one clinical pharmacy specialist who's excited to add contraception to their daily prescribing, one project coordinator to facilitate the moving parts, one physician champion to support the pharmacist, support from local leadership, and support from clinical informatics to get everything up and running. So let's reel it in. Contraception on Demand offers veterans safe, patient-centered, timely access to hormonal contraception. It uses our existing workforce and reduces burnout. With access to reproductive health services declining across the country, it's more important than ever to ensure that our veterans have access to the contraception they need and want when they need and want it. Contraception on Demand can help you do just that. Thank you.
Well done, Deirdre. Thank you so much for that pitch, and congratulations. It looks like you are one of this year's promising practices.
Yay.
So I'm going to walk you through. Round of applause. You have received one bid from a regional shark. So although it is just one bid, they're bidding on behalf of 4 facilities today. The 4 facilities are Orlando in the house, Tampa, Miami, and West Palm Beach. So I'm going to walk you through some of the highlights of this bid. You don't have to make any choices because you got one. So let's talk a little bit about what they're going to bring to the table to match what you've got. So these 4 sites in this region say that they have over 35,000 veterans that fall in the category to really need these services. So they want to reel you in to help them out. These sites have already engaged with pharmacy and women's health to support implementation, so they've started laying the ground level already. The implementing facility fellows identified to help with base camp and beyond are on-site folks who will help drive the implementation, so they are really laying the groundwork. And they can also sponsor travel for practice implementation, which we know is huge, to be able to do that necessary on-site work. For the implementation fellow to travel to the 4 sites during training in spring of 2023.
Woohoo!
So what do you think of this bid, Deirdre?
I think this bid sounds spectacular. I'm super excited to work with Biz and 8.
Excellent. Well, I am so thrilled that our first pitch of the day has been matched, that we've got a bid, that we're super successful, and one last round of applause. Well done. Thank you.
Coming out of the gate firing with our first promising practice. We love to see it.
Absolutely, Danielle. What a strong start. Let's get our next finalist rolling. Finalist number 2 is Dr. Adam Bach from Minneapolis VA Medical Center presenting CPRS Booster Robotic Employee Accelerator.
All right. Thank you. So what problem does CPRS Booster solve? It solves the problem that electronic medical records and clinical computer systems are horribly inefficient. They increase burnout and they reduce job satisfaction. In fact, how bad is the problem? This study shows that primary care physicians spend more than half of their workday, more than 6 hours a day, interacting with computer systems. And that's where CPRS Booster comes in. CPRS Booster is a computer program that automates tedious, monotonous, inefficient computer tasks so that healthcare professionals can focus on healthcare. It's currently available for free right now on every single computer in the VA system. Let's look at just one of many examples of what this program does. This is a note that I have signed. Many times a day, I need to indicate to the computer that I need to send this note to my nurse and to my clinic assistant for co-signature. Before CPRS Booster, that required 2 separate mouse movements, 3 separate mouse clicks, and the typing of 10 letters into the computer system. Now let's watch a video of CPRS Booster doing this. With CPRS Booster, all I have to do is press a single key, the function 2 key on the keyboard. And I want you to watch very closely as this happens. Don't blink, here it comes. Ready? Function 2. And those, my colleagues were instantly, in the blink of an eye, added to that note. How about the results? How do we know that CPRS Booster is helping us? Well, for one thing, CPRS Booster spread entirely by word of mouth from VA employee to VA employee across the entire United States, such that there are now over 30,000 employees using this program. Additionally, in one of the most amazing experiences of my career, spontaneous feedback poured into me from all parts of the country, with people telling me that Booster is a game changer, a life-changing, a game changer. How about some more quantitative data? This is a question taken from a survey of over 900 Booster users, asking them to rank how helpful Booster is compared to all other VA enhancements to the electronic medical record. How did they respond? The average provider, 9.7, nurse, 9.5, pharmacist, 9.6. So you might wonder, why should you bid on a freely available piece of software? And the reason is that even today, 2 years after this software was first released, many people still don't know about it. If you supply some of your employee time, I will personally work with those employees to make them super users and help them become effective champions of this burnout reducing, efficiency producing, and happiness inducing tool. Thank you.
So congratulations, Dr. Bach.
Thank
It looks you are one of our promising practices for
thank
this
you.
year.
Oh, fantastic.
And you have 2 bids to choose from. So you have to choose one before you leave the stage. No pressure.
Yeah.
So the first bid is coming in from Vision One, Northampton Station in Massachusetts. And they are offering the items that you requested to ensure success of implementation. The second is Vision 4, VA Pittsburgh Healthcare System, which is also offering what you need, but they also highlight their 1A facility serving over 78,000 veterans and a teaching facility with over 600 clinical trainees per year. How do you feel about that?
Well, those are very generous offers. I think, you know, a teaching facility with 600 trainees and a 1A facility, that sounds very exciting. In truth, I'm happy to help any VA facility interested. I've spent a lot of time trying to spread this program, and so if you're interested, please reach out to me, but I'll go with Vision 4, sure.
Vision 4, well, congratulations
Yeah,
to
thank
Vision 4. And when this is done, VA Eastern Colorado will be in touch with you.
Scooping them all up.
I love Colorado.
Let's
so
talk.
Great. Yeah, yeah.
Congratulations.
Yeah,
Another
thank
round of
you.
applause.
Thank you.
Well done.
And a second successful Shark and finalist story.
Let's see who we have for our third finalist. All the way from Orlando VA Medical Center, it's Adelina Sowell presenting Employee Wellbeing and CARTS.
Hello, Sharks. I'm here to tell you about the Employee Wellbeing Centers and CARTS and how they support employees in self-care, reduce stress, anxiety, and enhance employee retention. We know that healthcare workers have one of the highest rates of burnout professionally of all professions, and COVID-19 added fuel to that fire. So let me ask you this question. Is your stakeholder experience declining? Do you find that you're training new employees over and over again because of high turnover rates? Is your employee morale suffering due to this instability? And do you want to prove that you are a high reliability organization and more than name only? Well, the Employee Wellbeing Centers and CARTS can address these issues and much more. So we took an innovative and whole health approach to self-care using methods from the Circle of Health. And these tools are customizable and can be adapted to your team's needs and space. Some of the self-care tools can include zero gravity massage chairs, who doesn't love those, red light therapy, VR headsets, and so much more. But ultimately, healthy employees lead to better patient outcomes. So this project has already been successfully spread to 13 sites of care who have either already adopted it or in the process of adopting it. Over half of the employees in Orlando have been touched and benefited by this program. And all across VHA, weekly, we hear from other sites who are doing exactly the same thing, and many of them reach out to us and ask us for more information and assistance. So this is already a successful project that is rapidly spreading. So, Sharks, we know that there are critical staffing shortages in healthcare all across the country. And healthcare employees can pick and choose who they want to work for and where they want to work. So Sharks, are you going to keep swimming and moving forward so that you can invest in your employees' well-being? Then you can make sure that your organization survives and thrives. And I also want to give a big shout out to the rest of the team, Ashley Rush and Christina Mercado Acevedo. Our team has proven success, several years of experience, and we can do the exact same successful spread to your sites. So Sharks, are you going to bid to take a bite out of employee burnout? Thank you.
Well, Adelina, that is such an important practice, addressing such an issue that we're facing day in, day out. And so once again, congratulations. You have been selected as a promising practice as well.
All right, thank you.
Kudos to you and the team in Orlando, and you guys keep pushing. So some of the bids that we received, we're going to review two, and similar, we're going to try to get you to choose one before you walk out.
Okay.
So we have two bids, one out of Vision 8, going back home to Miami VA, and the next one out of Vision 21. So it does look like Vision 8, they have a large number of high-performing employees ready to kick this off, probably right down the street from you guys, right?
Mm-hmm.
And
Absolutely.
it seems like there's a very close alignment to the organizational culture of Experience Miami VA. And they're very dedicated, they're ready to expand into VR and ready to actually make this happen. And the next one is out of 21, Sierra Nevada. And they talk about their goal to reduce employee attrition. They're ready to kick this off in 10 distinct physical locations and really try to address employee well-being and try to get our workforce to actually keep pushing forward. So really, really amazing project that you guys are doing on an issue that we know exists day in and day out.
Okay, well, these both look amazing. I will say that we're usually readily available in Vision 8 for anyone who needs assistance. So I think I want to select a Vision 21, and especially the fact that they are committing resources and staff to support this, which is amazing.
So what's really amazing, and I think Mike, you brought it up, part of being here is being able to talk about the work that you guys are doing and getting in the right forum, because a lot of conversations happen, not only here, but the folks watching, the folks that are going to reach out to you, reach out to innovation, reach out to diffusion, and you spread a lot of the practices even beyond 8 and 21. So congratulations to you and everyone else as well.
Thank you, and I do have a little self-well-being for all of you.
Oh, after this week, we need it.
Thank
Thank
you.
you. Well done.
Swimming right along to finalist number 4, Lauren Briggs is here to present e-screening. Lauren joins us from Eastern Colorado Healthcare System.
Good afternoon, Sharks, and hello to everyone visiting with us here across the country. I'm here to talk about e-screening, and I'm trying to explain to you how veterans are coming into VA appointments and leaving not having their needs met. Why do we think this is? A lot of our time is spent on mandatory documentation. What if I was to tell you that we have a solution readily available across the country to every VA facility at no cost to that facility, which would improve veteran satisfaction and decrease provider burnout? E-screening is that tool, and it is readily available right now. E-screening is a solution that allows veterans to provide clinical information prior to the VA appointment, which allows us to really focus on our veterans' needs in the appointment right then and there, so that we can really get a good understanding of what their needs are. E-screening is a web-based platform. It pushes and pulls to the electronic medical record. It has an editable text note when veterans provide responses via e-screening. It clears clinical reminders and generates health factors. E-screening not only helps in reducing provider burnout, but it also helps for time and cost savings. Typically, veterans and providers can save anywhere between 15 to 60 minutes when using e-screening prior to a VA appointment. In terms of cost savings, one time saving study found that just to complete clinical reminders in the primary care setting, a typical VA facility spends $1.6 million per fiscal year. Translated to 7 FTE physicians and 5 LPNs. Imagine the force multiplier if we were to use e-screening to collect this information and complete this mandatory documentation prior to the clinical visit. Most importantly, e-screening gives veterans a voice in their care. So one ALS veteran that used e-screening that had lost the ability to speak due to his service-connected ALS identified that this was the first time he was able to actually participate in his care, as he had lost his voice due to his ALS. And I think that that really speaks to the volume of giving veterans a voice in their care. And I am so happy to be here today to talk about e-screening and how it is a tool that is aligned with the mission of reimagining veteran healthcare. Thank you.
Thank you so much for that pitch, Lauren. And I have to say, I mean, practices like this are spot on. We really need to make sure that when we have that human-to-human interaction, we can maximize it as much as possible. So I also want to say congratulations, because you are one of this year's promising practices. You have 2 bids from which to choose. So we're going to hold that round of applause, although well-deserved, because you have a decision to make. So our first bid, Vision 16, Central Arkansas VA Healthcare System. So they have goals, much like many sites, to reduce employee workload and burnout. They want to fully implement this practice in order to do so. And they will give you a facility implementation team to ensure its success, including a primary care APRN clinical educator, primary care RN, associate nurse executive research, clinical informatics champion, a primary care program analyst, and more. So it sounds like they are committed there. There's also an executive sponsor at their site helping to remove any roadblocks, and they also have a committee. It says committee to providing required and preferred resources. I'm thinking that's a commitment to provide more resources. Vision 10, the Richard L. Roudebush VA Medical Center in Indianapolis is a 1A facility. They want to improve some of their measures, reduce provider burden, increase compliance. Their DCOS wants to champion the effort. I have no idea what that is, so I'm just going to say it. Somebody does. Oh, their deputy chief of staff. That makes sense. I come from a very small VA where there is no deputy chief of staff, and would provide more resource to expand upon successful implementation. So that's a little curious there. What do you think of these two bids?
I think I'm going to be going with Vision 16, Central Arkansas VA Healthcare System. Due to the amount of resources that they're willing, I think e-screening implementation is really a team approach. And to really spread e-screening across the healthcare system, you need those resources. So excited to work with that healthcare system in Vision.
Amazing, we've made a match. Well done. Vision 16, you're getting e-screening.
E-screening sure seems like a heavy hitter.
You're telling me. Up next, our fifth finalist is Dr. Elizabeth Eichmann from Kansas City VA Medical Center. Dr. Eichmann is going to pitch on improved safety of enteral tube medication administration.
Thank you. I'm thrilled to be here on behalf of the tube team. Imagine a veteran with a new enteral tube surgically placed into a stomach, a life-saving tool for nutrition, hydration, and med administration. After tube placement, the veteran is given some general education about how to crush and administer his meds by tube. At home, the veteran crushes his pain medication, morphine extended release, and he suffers an opiate overdose, leading to an ER visit. When meds are given by tube, they must be manipulated in some way, like crushing a tablet or opening a capsule, and some meds, like the morphine extended release, become more toxic when crushed, and they're simply not safe for enteral tubes. Not all routes are created equal, and the enteral route is clearly different than oral and requires med experts to ensure that it is safe and effective. When we first started investigating current prescribing practices for patients with enteral tubes, we found that within the computer record system, CPRS, both locally and nationally, there was no system to alert a medical staff that the patient even required an enteral tube, and staff was left guessing. We also found that all too often, med administration was an afterthought, left at the discretion of the patient or caregiver at home. And the scenario described was an all too real possibility. Med administration by tube is complex and is prone to error. These errors can lead to reduced drug effectiveness, increased toxicity, tube occlusion, increased healthcare costs, or even deaths. So to address these problems, we created a clinical reminder order check, or CROC, within CPRS. This technology identifies the patient as requiring an enteral tube and alerts both the prescribing provider and the processing pharmacist to the enteral tube needs of the patient. In conjunction with the CROC, we also created a pharmacy enteral tube consult to evaluate medication efficacy and safety. You can see the success of our innovation. At baseline, among 41 veterans with enteral tubes, we found 41 medications that were not compatible. With our CROC and our med review process, we reduced this to just 6 within 1 year. Reducing med errors also reduces healthcare costs. We found that extrapolating from research, the annual cost avoidance of these med errors was over $37,000 for just within our VA facility. With our CROC, templates, order menus, we can easily expand this safety feature to your VA. So now, reimagine our veteran with an enteral tube. But this time, the crock is active in CPRS, and Dr. No Longer Guessing is able to change the morphine extended release into a medication that's safe for enteral tubes. Our process reduces med errors, increases staff confidence when managing these complex needs for veterans, and lets patients know they're not alone.
So Dr. Eichmann, while it seems like you've made tremendous impact at your facility, unfortunately we didn't have any sharks take the bait. So it doesn't mean it's over though. So please keep your page up on the diffusion of excellence so people can see, and anyone watching today, if they choose, they can reach out to you to potentially partner with you. And looking at your presentation, I'm wondering, you showed an ROI from a fiscal perspective, but there wasn't anything showing safety or quality measures, but you made reference to that. Do you have that data?
There were 41 meds that were prescribed that were not compatible with enteral tubes, meaning there are potential medication errors. And we reduced that to just 6 in 1 year. So we reduced it by 85%. Reduced med errors. So those did not reach the patient because of our interventions.
So Dr. Eichmann, I will say you have a much broader platform now with
Yes.
everyone watching from your sites, because this is really important work. And when sharks are bidding, there's just a smaller slice.
Yeah.
So everyone watching from home or from your sites, can you tell folks a little bit about what it would look like if they could just, is it easy to implement your crock?
Absolutely.
Tell them a little
It's,
bit about that.
The crock itself is cost-free. Your CACs can implement it within CPRS. We have the technology. We're willing to share. We'd like to get it out to everybody. Once it's implemented, both the provider, when they enter an order for the patient that has an enteral tube, they're going to be able to get an alert, basically almost like a drug interaction alert that says, hey, the patient has an enteral tube, make sure that's safe before you prescribe it. And the processing pharmacist gets the same alert as well, so it's a double check safety net to make sure that meds that can't go down the tube don't get to the patient.
Yeah, important. So anyone
Very
who's
important.
interested in this, reach out to Dr. Eichmann, take a look at her Diffusion Marketplace page, because this is important stuff. Thank you so much.
Thank you.
Thank you.
Even though we didn't see any bids come through for that finalist, we love to learn more about practices here at Shark Tank.
Absolutely, Danielle. It's happened before that some facilities reach out to them directly to implement.
That's great, Blaine. If any facility or regional director sharks out there liked that practice, make sure to reach out to them directly through their Diffusion Marketplace page.
Let's get back to it, Hagen. Our 6th finalist joins us from James H. Quillen VA Medical Center in Tennessee. Kelly Jones is going to pitch improving communication in home-based primary care.
Good afternoon, Sharks. On behalf of my team, I am here to share how standardizing workflow practices can improve communication within your home-based primary care teams. Our practice comes from the heart of the Appalachian Mountains, and we serve some of the most vulnerable veterans for the VHA serves. Have you ever tried to contact your care team only to wait an extended amount of time to get a response? Well, in the height of the pandemic, this deficiency impacted our HBPC program. Driven by workflow processes being inconsistent and poor communication problems between staff and between patient and provider, patient satisfaction suffered. To address these deficiencies, our team used a 3-prong approach. First, we streamlined incoming calls to one direct line. This created consistency in who answered the phone and decreased demand on the clinicians in the field. Second, we created a call disposition guide. This tool has a trigger list of words that are elevated to the telephone triage nurse, a mental health crisis call guide, and a list of complaints that the disciplines are responsible for resolving. Lastly, we created a wellness checkup tool. This simple stoplight tool provides the veteran and caregiver with a guide on when to take caution and contact their care team, as well as when to call 911. After implementing these processes, we saw a significant increase in both patient satisfaction for communication between patient and provider and call disposition accuracy. This created a better access to care within our program and reinforced the idea that we needed to have a consistent unit, for the patient. All the while, it helped Mountain Home to become a leader in veteran experience. In summary, we must drive veteran satisfaction. Improving veteran satisfaction is vital to helping veterans be able to experience care within the VA better. Using standardized workflow processes is a low-cost, big reward opportunity for your facility. The words of a veteran's caregiver who recently lost her husband share the importance of this action. In a letter, she expressed gratitude to her care team and specifically mentioned the diligence of those who answer the phone. This is our call to action. We must improve veteran experience. Replicating this process in your facility will help you do just that. On behalf of our team, thank you for allowing us to share and spread our practice.
So Kelly, that is truly, truly amazing. You know, I see here, on how you connected everything back to pandemic and the multi-pronged approach and the entire aspect of patient experience. We know that improving patient experience is all of our jobs, especially during the last couple of years, the transition coming in out of the pandemic. So I commend you and your team on making the connection to improve that aspect of care and truly, truly know of the work that you guys are doing.
You better tell her if she won already.
It's amazing. I'm just sitting here listening to the pitches, and
I know,
it
I
is
was kind of
unbelievable
waiting
the work
too.
being done across the VA.
Dangling.
So yes, congratulations, you are one of the promising practices, followed by 2 bids. So again, we're going up to Vision 1 and down to Vision 8. Vision 1 out of Bedford. So they're ready to provide not only IT support, but some staffing support. And it looks like they have a ready program to help kick off and support, throw a lot of the FTEs per each veteran enrolled in the program. So Bedford is ready to step in and deploy this at their medical center, but also making our way down 95 to Orlando, VA, out of Vision 8. And they also have over 600 veterans enrolled with a continuous growth. And they are ready to push out FTE to help enforce and increase the program. So having said that, again, like I said, congratulations, really amazing work. So what's on your mind?
Oh my.
I do want to point out that Vision 8 may purchase a laminator. They're open to it.
Yeah.
That might tip the scales.
Yes.
Well, I have been to the Orlando VA. It's a very beautiful campus. And they do have a quite large HPC program. And so I may be able to learn some stuff from them as well. So I do choose Vision 8 in Orlando VA Healthcare System.
So I am out of Vision 1, and I would welcome you to take a trip up 95 and come work with us as well. But congratulations, Vision 8. Congratulations, Kelly.
Love
did
a
not
good
for a
practice looking to improve communication.
She did not.
You betcha, Blaine. Clear communication is great. Wouldn't want to muddy the waters. Our 7th finalist is Sean Rubel from Northeast Ohio Healthcare System. Let's hear about in-house eyeglass fabrication for blind rehabilitation.
Good afternoon, everyone. I bet most of you in here know that the average turnaround time for glasses from a VA optical or a specialty optical lab is 4 to 6 weeks. What I bet you didn't know is that the average length of stay for an inpatient, low vision, or legally blind veteran at a VA blind rehab center is 28 days. Let those 2 numbers sink in for a minute. I have a local veteran that suffers from a corneal disease, one of the harshest conditions for light and glare sensitivity. One day, he came into our center absolutely distraught. He had broken his specially tinted wrap-style frames and was already experiencing symptoms, including severe headaches and eye pain. Like this veteran, many low vision and legally blind veterans suffer from extreme light and glare sensitivity. They rely on these special tints and frames to protect their eyes and maintain what little vision they have left. Prior to the in-house eyeglass fabrication program, this veteran would have had to wait 4 to 6 weeks for relief. But because of the program, he was able to receive an identical replacement pair the very next day. Excuse me. I'm blanking now. The long wait time for glasses affects both inpatient and outpatient veterans. Inpatient veterans aren't even able to receive their glasses while they're in training to assess and use in conjunction with their low vision devices. Instead, the glasses are shipped at an additional expense to the veteran's home, where they're forced to secure transportation to the nearest VA to have the glasses properly fit. This leads to incomplete assessment of low vision devices, lower success with low vision devices, and often unused prosthetics. Outpatient clinics have similar issues, with many veterans completing a low vision exam and a device assessment the same day. These veterans are shown devices that can change their lives and often allow them to do things they haven't done in years. And then they're told, well, you gotta wait 4 to 6 weeks. Can you imagine waiting that long for your glasses, but then also for all your cool new stuff too? The in-house eyeglass fabrication program fixes all this by making the glasses in-house at the Blind Rehab Center. This, coupled with a streamlined ordering process that eliminates the middleman, has allowed Cleveland to reduce turnaround time from 4 to 6 weeks down to 5 days. This last year, it was spread to 4 additional sites, and with the addition of these sites, the program's success continued with an average turnaround of 7 days and an overall cost savings of $163,000 and growing. Most importantly, though, is there was 100% veteran satisfaction. So with minimal change to your existing ordering process, your facility or your VISNs, low vision and legally blind veterans can also experience the multitude of benefits this program has to offer. Thank you.
Excellent, impressive.
Yeah. First off, Sean, well done. This is hard work. It's hard to get up on stage and do the thing, but you're doing it, so well done. And I would like to say that congratulations. You are one of this year's promising practices.
Oh, thank you.
So take a deep breath. Woo! A fun fact, one of my first gigs in the VA back in 2006 was supporting a visually impaired service team, and I know firsthand what you're talking about. This is life-changing stuff. So you have one bid, so you don't even have to think anymore. You don't have to make any choices,
awesome.
But let me run you through it. So our bid is from Vision 16, Gulf Coast VA Healthcare System in the house. And they are one of 13 blind rehab centers nationwide with around 700 visually impaired veterans who are being served out of this center. So it sounds like it's a really great match for what we're talking about here. They're really focusing on how your practice can heavily reduce travel burdens for veterans, as well as just getting them what they need and want as immediately as possible. So they are currently at 6 to 8 weeks wait time for eyewear fabrication. So they recognize this problem as well, and they want to team up with you to fix it. They're committed to providing all resources for implementation. So that is a very bold thing to say. And I know the folks down there, and I trust them. They absolutely will. They've got leadership support and 2 dedicated innovation specialists, which is fantastic. Amazing to add to the mix. So Liz is one of them, and they'll take good care of you. Any words, any thoughts about this bid? Anything to say?
No, thank you. I mean, it's just been an awesome ride. I'm ready to help other people experience this. It's been wonderful in Cleveland and at the other couple sites. So just thanks.
Awesome. Well, congratulations again.
Thank you.
Thanks so much.
What a fascinating bid with great potential to help veterans.
Our pitches so far have all been so inspiring. It's great to see what innovations we have coming right out of our own VHA staff. Our next practice is the Medical Companion Program. Stephanie Salwin is here to present, and she's coming from Edward Hines Jr. VA Hospital in Illinois.
Thank you and good afternoon. The Medical Companion Program seeks to connect our most isolated veterans with companion care services so that they can complete their invasive outpatient procedures in the outpatient setting. We do this by partnering with local home health agencies who already provide this service as a routine part of their care. We're just simply bringing that to VA to serve our most neediest patients. Eligible veterans do not have any friends or family members that they can call upon to serve in this role. They also complete a thorough assessment to make sure that all other attainable and available VA resources that can meet this need have been exhausted. It is estimated that within VA, 10 to 20% of our veterans do not have a responsible adult that they can naturally call upon to serve in this capacity. This exacerbates healthcare disparities by delaying necessary preventative care or treatment. And it also has a significant impact on our inpatient VA resources when these resources are offered to patients to facilitate their outpatient procedures. At Hines, we know this all too well. In FY 2018, we admitted 149 veterans to the hospital to facilitate their outpatient procedure at a cost expenditure to the government of $447,000. It is why Medical Companion Program services matter. For example, we had a 66-year-old female veteran who was in need of a routine colonoscopy, but it kept getting delayed because she simply just couldn't identify anyone that was available to accompany her. When the Medical Companion Program first rolled out, she was first in line. So why should you bid on this innovation? Well, not just because medical companion services matter, they also work. They reduce the need to utilize inpatient hospital beds by nearly 90%. At Hines, between FY18 and FY21, we reduced the need to utilize our inpatient beds to facilitate outpatient procedures by nearly 91%, from 149 veterans to 14, at a cost savings to the government of $395,000. I'd be your liaison to bring this impactful and life-saving program to your VA Medical Center. And when I say life-saving, I really do mean it. Remember that 66-year-old veteran? Well, she finally got that colonoscopy utilizing Medical Companion services, and not a minute too soon. Why? Because during the procedure, they found a polyp, one that had the distinct possibility of turning into colon cancer had it not been successfully excised. Thank you for your time.
Stephanie, you and your team, it appears you're doing tremendous work and you're getting patients the right level of care in the right location. It's never a good situation when we need to admit for an outpatient day procedure. I'm surprised the financial savings aren't more than what they really are with the numbers you're describing, but bravo to you. And congratulations, you're one of our finalists.
Thank you.
And best promising practices this year.
Thank you.
You have one bid, so you don't have to make a decision on who you're going to partner with.
Great.
But let's go over that. It is with VA Pittsburgh, and as we talked about earlier, they are also a 1A facility, and it has full leadership support to partner with you. And just congratulations. Do you have any additional updated data that you can share?
Yeah, our FY 2022 data is trending very similar to our FY 21 data. We're seeing about a 41% increase in program utilization in this past fiscal year, and we will have served 216 veterans who successfully completed their outpatient procedure in the outpatient setting. So I think by the time we crunch all the data and punch all the numbers, we're going to be able to demonstrate a cost savings to the government of nearly $500,000.
Nice. And I bet you the veterans are way more satisfied.
Who wouldn't be?
Congratulations.
Thanks. Thank you.
And while she's leaving, remember, if you're interested, you too can also contact her.
Another awesome practice, another solid bid. I would have a hard time if I had to choose between two.
Me too, Blaine. Practices and bids today have been exceptional. Up next is a practice from my old swimming hole, Mary Gorman from VA Ann Arbor Healthcare System with Michigan Market Referral Coordination Initiative, a commitment to offering veterans a VA option for specialty care needs.
Hey, Sharks. As working in the Office of Community Care, I've run across many veterans who have had care that's been fragmented, loss of care coordination, been sent bills, and even sent to collections. So the problem we identified is that veterans with medical and surgical specialty care needs that were community care eligible were not even offered a VA option for their care, despite high quality, timely VA options available. So we create an RN-led team that does referral coordination and care navigation for all medical and surgical specialties across the Michigan market. We explain what VA has to offer, and we connect them with the needed resources. We offer VDC, CVT appointments, we do e-consults, we do phone calls or face-to-face visits. And we move the care forward based on the veteran's choice. We have access to the Michigan market electronic medical records. We facilitate the required workup prior to the visit. And we are the central point of contact for both the referring and receiving clinics. We engage in tracking of the care consult from the initial consult all the way to the completion of that consult for when the patient actually has the appointment. And we hold the receiving clinics accountable for a really high level of customer service. So the outcome or the return of investment of over a course of 1 year, we drafted 10 medical surgical specialty service lines into our program, partnering with 2 low complexity VA facilities. And we processed a total of just under 12,000 consults, with just under 40% of veterans opting to stay in the VA healthcare system. With this retention, we eliminated barriers utilizing just VA resources. If a veteran had problems with transportation, we helped them get a ride. If they had trouble staying the night, we utilized lodging. And with this, we had a total savings of just under $24 million in our first year alone. And these are just our team members. We have directors, chiefs of staff, we have group practice managers, community care, and these are our 4 sites: Battle Creek, Saginaw, Detroit, and us here in Ann Arbor. Thank you so much.
Well done, Mary. You know, while it sounds like you've had tremendous impact at your medical center and the 4 facilities, at this point, there was no bites, no bids to your practice. However, like we talked about, part of being here, sharing your experience, your practice with the larger community, with us here and watching virtually. So can you share a little bit more about feedback?
Leah, can I jump in here?
Of course.
I'm so sorry, because I have to say that it is bananas that you didn't receive any bids, because we are hemorrhaging money out to community care.
I was thinking the same thing.
So there is clearly a storytelling or a narrative issue here. 40% of veterans opting to stay. 40%. That is huge.
Yes.
$24 million is huge.
It's a lot of opportunity.
Is huge. So everyone who is watching, Mary, I wonder if it might be issues with the way that you're marketing this, right? Michigan market referral, people saying, well, we're not in Michigan, so clearly that's not for us.
So actually, I'm wondering, how is this different from the nationally driven initiatives?
So my team of nurses, we call every veteran and offer them either a VA option to stay in care or community care, because that's the national, directive. And so we're really good at getting to yes, as my boss says, if a veteran wants to stay in the medical center. So we offer transportation, we offer virtual visits, we offer the labs in their home sites. So all their CBOCs that have labs, we order those labs and get them done prior to their first appointment.
So it sounds like a little culture and positive attitude and getting to yes and really helping them navigate the system more.
Yes,
So
and
that
help with
sounds more
travel.
training and something about your environment.
Yeah, so Mary, I don't have a big facility. I don't have any money or resources or people, but I do have storytelling skills. And I can promise you, if you want to work with me over the year to refine how you're marketing this to people, I think that with some easy tweaks, we can get you some bids next year if you come back.
Absolutely.
Great, thank you.
Thank you.
Yeah, yeah. And I think I'm going to have my team call Mary. So, because we're hemorrhaging in community care, right?
That was fantastic. Our Sharks are really doing a phenomenal job of coaching our finalists today, Blaine. Remember, our audience Sharks may reach out to them through their Diffusion Marketplace page if they want to work with the practice.
Big props to our Sharks indeed, Danielle. Let's get back to our pitches with Robin Islam from Corporal Crescens VA Medical Center in Philadelphia, pitching the National Teleneurology Program.
Yay.
Great, good afternoon. Thank you for the opportunity to be able to talk about the National Teleneurology Program, or NTMP. As healthcare professionals, we understand how difficult it is to retain and recruit specialists within our healthcare system, regardless if you're in the VA or not. And this is no different within the neurology department. Our goal is to focus here to be able to support the neurology services within the VA. So here in 2020, the American Academy of Neurology published this number where they're showing the number of neurologists for every 100,000 capital within the United States. Excuse me. And if you spend any time with IEX this week, you've noticed a general trend of lack of access, lack of equity, and disparity in care, especially within neurology. That's what I live and see every day. So what we look at is, in this particular graph, I happen to be a minority and actually very fortunate to live in one of the dark green states that's noted by the American Academy of Neurology. I also happen to be an oddity because I live only 6 miles from the VA Medical Center where I choose to get my VA healthcare services from. In my arduous commute of 6 miles, I actually pass 4 community healthcare systems to get to the VA. Wow. Not 2, not 3, but 4 community healthcare services and healthcare systems within the city that I live in. And imagine that, if my clinical care team decides to send me to a community hospital, it can take, depending on the time of year that they sent me, or I call those community hospitals, it may take me 4 to 8 months to actually see a neurologist within the community. So then, this is how NTMP comes into place. We're looking at an opportunity to be able to provide services and inject our neurology services into rural patients. Rural patients make up 1 out of every 3 patients that are enrolled in the VA healthcare system. We're trying to take a solution that's already in existence. We leverage technology services and infrastructure that is already available within the VA system and provide that reach to the veterans in rural communities primarily. So we take that healthcare out of the brick and mortar of our hospital systems and take the care directly to where the veterans are. Excuse me. So what we try to do is, if you haven't had an opportunity, is to look at my Marketplace website and to notice exactly where we are, what resources we need, and how we can actually leverage the resources that are available to be able to provide these services to your healthcare system. If you're able to and you have any questions, feel free to reach out to me. I am more than happy to be able to implement, and hopefully I threw enough chum in the water to be able to get some sharks to bite and to be able to take a bite out of the headache out of the neurology care services. Excuse me. Well, appreciate it. Thank you so much.
Well done. So, Robin, I had a blast last night talking with you and learning a little bit more about the nexus of this program. And first, I want to commend you and your team for really helping to shift us towards, we say we're the nation's largest integrated healthcare system, and in many ways we're not, but this is something that helps move us that way. So I'll stop blathering and I will tell you whether or not you are a promising practice, and you are a promising practice, and you have a decision to make.
Yes.
So we've got 2 bids coming in, and they're from 2 sites that I dearly love, so I'm going to try my best not to sway your decision here. So bid 1 is from Vision 10, Cincinnati VA Medical Center. So Cincinnati says they are committed to providing all resources, including those and any that may arise. So I don't know if you need like a stretched Hummer limo or something. I'm kidding. I'm really kidding. None of that. Clinical Resource Hub, VISN lead support to spread to other areas in the VISN as well. So they're already looking at eyeballing, spreading and scaling.
Sure.
And that they're the same facility where tele-ICU was implemented. So they've got some groundwork laid.
Of course.
So then our second bid, VISN 21, San Francisco VA in the house, 1A hospital affiliated with UCSF, neurology and neurosurgery program, ranked second in the nation.
Absolutely.
So the director and clinical leadership support, they are also committed to providing all resources, and staff, they have a Parkinson's/epilepsy specialists due to their Parkinson's clinic, and would hire 1.0 FTE, woo, San Francisco, man, to support an increased consult capacity. So who are you choosing?
Oh my goodness, what a choice. It's an honor to be selected. VISN 10, we've worked with a couple opportunities. They're a wonderful healthcare system. They're right adjacent to us. But especially looking at VISN 21 with an academic affiliation with UCSF, you can't compete with that, especially within neurology services. Having the commitment to be able to go into specialty care, subspecialty within neurology, which is one of the ventures we're moving to this fiscal year, I'm leaning towards VISN 21 to be able to build that partnership to the West Coast.
All right, is that leaning towards your selection?
That is my VISN 21, I'm coming for you.
I love it, well done.
Thank you very much.
I think it's because it's near wine country.
I'll say that when the mic is turned off.
Okay.
Well done, Robin, thank you.
Thank you so much, appreciate it.
That pitch really brought down the house.
Are you gonna raise the roof next? Our 11th finalist is Dr. Vasalo Maluk from VA Pittsburgh Healthcare System. Dr. Maluk is pitching preventing post-operative readmissions with surgical safety net.
Hello everyone. Why do we need a surgical safety net? Post-operative readmissions are a huge burden on any hospital system. They affect the morale of the surgical team, hospitals' metrics and finances, and mostly veteran dissatisfier. 2 years ago, we saw an 80-year-old patient in our clinic whom we optimized for a hip replacement surgery. Surgery went very well. We sent him home on aspirin for blood clot prevention, and mistakenly the veteran thought aspirin was for pain, and so he ended up taking it only as needed, ended up in the hospital with a blood clot in his lung. He almost died. That's clearly an avoidable readmission. Our team went back and looked at our hospital readmission rates, and we learned that we are in the 4th quintile, not a good place to be in. So we desperately needed a process to improve our hospital standing and veteran experience. Given our successful track record in preventing like a clinic that was JCO approved, our team set into to find a solution for this readmission problem. Hospitals are very good at reaction, but surgical safety net focuses on prevention. Just like Tom Cruise predicted crime before it happened in Minority Report, we selected a prediction model to identify high-risk patients. We empowered a nurse navigator to execute this readmission prevention protocol, and we also provided a 24/7 virtual coverage along with telephone and video for all post-discharge issues. Using our nurse navigator as the anchor, we expanded our process to a multidisciplinary model, leveraging existing team members from key departments. Preoperatively, we consulted social work to do discharge planning, palliative team to discuss goals of care, and rehab medicine to provide a safe surgical home. And our nurse navigator made scheduled phone calls to address issues as they arose. She ensured medication compliance, like taking aspirin regularly after surgery, and also safe opioid use and disposal and several other issues. The process became an instantaneous success for all parties. One veteran commented, "Because of my experience with the Impact Clinic, I would recommend this hospital to anyone." And we received similar praise from all other stakeholders. And our outcomes were equally very impressive. In 2 years, we jumped from 4th quintile to 1st quintile, and our readmission rate dropped by 25% by NSO report, and we saved over $1 million for our VA. So sharks, Readmissions are a real problem, and surgical safety net is the solution. If you believe me, bid on me, and we will take our veterans to a very safe surgical journey, the veterans who keep us safe. Thank you.
So, Dr. Maluk, thank you for your presentation, and honestly, I'm wondering why my facility did not submit a bid on this, and I'm going to go back and ask them about this. But congratulations, you are one of this year's Promising Practices.
Thank you.
So, Vision 16, they look like they're bringing it. You have one bid, so you don't need to make a choice. But it's impressive in their write-up to see that they're bringing together a full interdisciplinary team. They're bringing together the resources. It appears they have the infrastructure with good goals. And according to my notes, they have surgeon buy-in, which you know is probably the greatest barrier to
impress
achieve.
those surgeons, you know.
Yes, yes.
I'm married to one, so.
So, is there anything else that you would like to add about this amazing program?
Yeah, actually, after we implemented the initial phase, now we started a VVC method. Like we have arranged a multidisciplinary meeting for our veteran. He's at home, but the social work, the physical therapist, everybody can communicate with him while he's home and prepare the whole surgical post-discharge planning. In fact, the veteran can take his video monitor to show his bathroom for the physical therapist to see if he needs any more help in the house to make it a safe surgical home. So we are expanding our process as we speak. So.
Congratulations.
Thank you.
Such amazing outcomes going from 5th to 1st. So kudos to you and your team.
Thank you so much.
Well
Thanks
done.
for giving me this opportunity.
Wow, what a hole-in-one. Tee up our next finalist, Blaine.
Our 12th finalist is Lucy Austin from Columbia VA Healthcare System with two-step solution to solving the C. diff problem.
Good afternoon, Sharks. Today I want to share with you an amazing and proven solution to your high C. diff rates, two-step C. diff testing. Next slide, please. Our problem. Up until recently, we were using the one-step PCR testing to test for C. diff in stool samples. Active C. diff infections can cause abdominal pain, nausea, vomiting, and diarrhea. And these symptoms can lead to severe complications, even death. The one-step PCR method was unable to differentiate between colonization and active infections. Therefore, overdiagnosing was occurring. We had increased rates of C. diff in our acute setting and in the CLC. Increased rates means increased cost. The cost of a single case of healthcare-associated C. diff is over $34,000. Next slide, please. Our solution, our superstar team scoured the research and determined two-step C. diff testing would be the best solution to our problem without adding any additional equipment or staff. The first step is the PCR test. If the PCR test is positive, an additional second step test is performed, checking for antigen as well as toxin. If the toxin is negative, it is not a true case of C. diff. If the toxin is positive, it is a true case of C. diff. And to make all this work, we had to make sure to have the right order, the right stool sample rejection criteria, and the right education to all the caregivers. You may think that sounds like a lot of work, but wait, there's more. We've thought of everything and will provide you all the key information in a handy-dandy startup toolkit so that you can have your own rockstar team. Next slide, please. Our results. In the acute setting, our rates dropped by 51% with a cost savings of over $200,000. And in the CLC, the results were equally impressive with rates dropping by 100% and a cost savings of over $170,000. Next slide, please. Assuming other VA facilities have not already implemented two-step C. diff testing VA-wide, with a 51% rate reduction, that could result in a cost savings of over $17 million. So if you would like to reduce your C. diff rates by greater than 50% for veterans and save your facility over $34,000 per case of C. diff, bid on our successful project so that we can partner with you to get two-step C. diff testing started at your facility as soon as possible. Thank you.
Well done, Lucy. Excellent, well done. So although you shared an outstanding practice, it doesn't look like at this moment you're one of the promising practices, but similar to everything else, what we're seeing here is just truly, truly outstanding and unbelievable. But I'd like to spend some time a little bit, talk to us a little bit, the folks watching, some of the process at your medical center, your facility, throughout the implementation,
Well, we had a multidisciplinary team meet to gather together, and we brainstormed and came up with this solution, and it's just been a great savings, healthcare savings, as well as we've had improved rates.
And about the timeline, how did it work out from the time they kicked off to the time they're able to realize some of the savings and impact?
It took about 3 to 4 months before it took everything to take it into place.
Fantastic. So I encourage everyone to just keep your marketplace, keep pushing, keep driving.
I do want to chime in on just one thing, because Lucy, you said that you had a 51% reduction in C. diff sort of spreading across your inpatient unit. Is that right?
Yes.
And we talked a lot about the cost savings, but I don't know, I have never had C. diff, but I've heard a lot about it. That sounds awful. So we're talking about, right? Not just the cost savings, but true human impact. So, I mean, this is one of those things. If others who are watching, again, I think a lot of it comes down to getting in front of the right audience. You might be in front of the right audience now. Is it easy for them to implement outside of?
It is.
Perfect.
And we have all the tools in place.
Okay.
We would be happy to share it with you.
Amazing. Let's spread this practice and not C. diff.
Yes, exactly.
Thank you so much.
Thank you.
Thank you.
Just a note again for our audience, if one of these practices that does not end up a promising practice at our competition today, their information is available on Diffusion Marketplace if you would like to reach out to work directly with them.
And don't forget to vote for your favorite pitch of the day. We're nearing the end here. Our 13th finalist is Asher Shumanov from the Edward Hines Junior Hospital in Illinois. Asher is pitching Scarce Resource, Vaccine and Therapeutic, Centralized Distribution and Tracking Program.
Hello, Sharks. Have you ever had to collect a lot of information from a lot of people very quickly? We all work for the federal government, so we know the answer here. What tools do we typically use for this job? For me, I go to the communication tools, Outlook, Teams. If I'm feeling a little old school, I might pick up the phone and call. And these work great most of the time. But we all have those projects, you know the ones, where we end up in a situation like this, where we're sitting there late at night, burning the midnight oil, trying to wrangle together a messy spreadsheet of data, true story by the way, and watching our inbox counters continue to climb. There's got to be a better way. So during the COVID-19 pandemic, my program office was faced with a similar challenge, and we came up with one. We were, and still are, responsible for coordinating the distribution of scarce resources, such as the COVID-19 and later monkeypox, vaccine and therapeutic agents across the country. In addition to this, we were also responsible for making sure that our facilities report critical pieces of information back up to us and to various federal agencies such as the FDA, CDC, parts of HHS, and many others so that they can continue to do their important work managing this pandemic for our country. We chose to reach into our toolbox and build a new platform, one that was designed from the ground up to reduce the rate of errors, to help ensure appropriate use, and most importantly, in my personal opinion, to make things easy so our clinicians could spend less time chasing down the data and more time taking care of the veteran in front of them. This program was a success. We have over 500 facilities registered. In fact, your facility likely is one of them. We have over 3,600 active users on this, most of whom are pharmacists, physicians, nurses, and other clinicians. And we've distributed over 9 million doses of vaccine and therapeutic agents, 9.5 million as of this morning, to date. And with this platform, we were able to achieve all of this with a staff of 3 to 5 full-time employees. The good news here is if we can do it, so can you. The tools in our toolbox are freely available for anybody at the VA to use, and we have some phenomenal resources available here to help anybody at any level get started. Really, whether we are having a small project with fewer than 100 users or something huge with over 1,000, we want to use the tools in our toolbox so that we are not working for our data, but rather making our data work for us to improve veteran care. Thank you so much for your time, and thank you so much for everybody who helped make this possible.
Holy Shark Tank. Every shark came out for this one, right?
So Asher, your pitch was amazing. Unfortunately, you have not received any bids, so you're not going to be one of the promising practices. But I have a couple of questions for you, because it sounds like you have made a lot of impact, and you were talking about how you've got lots of users on your platform benefiting from your practice. Talk to people at home watching from their facilities about why they should become sort of super users or implementers themselves rather than just customers on what you all are doing. Help make that difference a little bit clearer.
Yeah, really what we're doing is we're proving that it's possible. If we can do this with the staff that we have and at the scale that we can do it, really anybody can do it. And these tools are available. The VA has some amazing, really truly amazing resources, office hours, and just training courses to help anybody get started. And whether you're really a techie person like myself or you're kind of interested, I think there's something at every level for that. So I think it's just a really good place to be and progress, to make things easier and really more efficient.
Yeah. So walk us through a story of tracking a thing, okay? So we're talking about scarce resources. I saw monkeypox vaccines.
Yeah.
What does that look like going through this platform?
So we partner with other federal agencies because we have to report this data so that we can get this vaccine and we have to get these. So really it's making sure that we're tracking utilization, inventory, and all of these critical elements so that we can report back up and so that these can be managed at a wide scale. Additionally, there's safety because these are all very new agents and there's a lot of questions about that. So we partner with the FDA on some of that and medication use evaluation, that type of thing.
So we're talking about, well, like let's go back to the monkeypox vaccine, where they are, who got what shot, what dose. You can reach back around to people if necessary. Is this what we're talking about?
Yeah, but really more of where it's located in the VA so that we can point people in the right direction.
Right, so if we need vaccines, where are they physically located right now? Excellent. Okay, anyone else with any other questions?
Location.
Yeah. Lester, thank you so
Thank
much.
you.
Keep doing good work.
Thank you so much.
Thanks.
All right, everyone, make sure you're getting those pitch of the day votes in.
That's right, Danielle. Polls close after our 14th presenter, Chris Earls from Charles George VA Medical Center of Asheville. We are ending today with a pitch on the White Noise Project.
Good afternoon, Sharks, and a quick shout out to Cindy Peters, my coworker on the project. We have a long-known problem in the hospitals. We struggle to provide rest for our patients. They have a lot of unfamiliar sounds, and they're in beds that are not their own, and they're not home. They don't have the comforts from home with them. We wanted to fix that, and we wanted to provide the comforts from home in the hospital setting. Our solution is this small device. White noise is ubiquitous in society. Everyone at least knows someone that is using white noise, and yet we had little data in hospitals about it, at least until now. Our project is simple. Bring white noise into hospitals so that we can get our veterans the rest they deserve. These specialty devices here are ensuring that quality devices make it to these hospitals. They are engineered for safety, ease of use, portability, adaptability, and for their quality of sound. Audiophiles worked extremely hard to make sure that these decibels in these devices are the actual noises that they are hearing, not just recordings. We have been working with a manufacturer that is excited to work with the VA, and we have also been making sure that these devices are safe enough to adapt to many hospital environments, even inpatient mental health. It was no easy task making all of this happen and come together. So we are swimming in data. Our data for the past 2 years on sleep and anxiety has been great. We have, in the past 2 years, seen consistent 20% improvements on sleep hours from veterans using white noise machines. We have 97% patient satisfaction ratings. Veterans are telling us that these machines are reducing their anxiety and increasing their sleep. They're even asking us how they can take them home. All of this without any risk to the veteran's health to try. We even have offices that are using these machines to ensure that the veterans have some privacy. So I want to emphasize that all of this comes at an affordable price. The Asheville VA Medical Center was funded for $2,000, both inpatient and outpatient, for years to come. They require no special training for staff or veterans to use, and they work. The bottom line is this: if you want to get your patients 20% more sleep and decrease their anxiety without the use of medications, simply bring this project to your site. Thank you so much for your time and consideration, and happy Halloween.
Thank you for your presentation, and love the outfit.
Thank you.
You're upping him on his sock game over here.
Nice.
So congratulations. You are one of our promising practices this year.
Thank you. Thank you.
And you had an overwhelming number of 8 bids. So you definitely caught the attention of many sharks out there. So let's go over the bids a little bit. So VISN 7 and 9 are competing for your partnership, and you are asked to choose one. So Tuscaloosa, they're putting in what's being asked and are committing to purchasing 14 white noise machines, where Memphis is going all in, and they are committing to purchase 130 machines. So what are your thoughts?
So any site that wants to bring this project to their practice, reach out to me. I'd be happy to help you and work with you through Diffusion Marketplace and all of that. But
Appreciate the attitude.
go big or go home, so I'm going to go with Memphis.
Memphis? Okay. Anything from the other sharks?
No.
Congratulations.
I want to hear it.
Yeah.
Oh, sure, yeah.
Good.
Yeah. What's it sound like?
Sounds just like that. It's got 11 different settings, and it's directional, so you can actually make it go up, make it go towards the patient, make it go away from your hospital so that it's interrupting people trying to listen in.
Love it.
That's much more pleasant than my air filter at home.
You're going to have to go on our website
I
and
think
see which
and
ones they're
purchase,
using.
yeah.
Well done.
This is great.
Congratulations.
Thank y'all so much.
Congrats.
Well, that wraps up our Hall of Finalists for this year. But don't forget to learn more about them and their progress on Diffusion Marketplace. I have to say, Blaine, I had a fantastic time. Wait, do you see that?
I do, Danielle. It appears to be someone swimming up. Great catfish. Is that you, Eric?
Woo! Yeah, it's me. I think that's gonna give me some great swimmer's muscles.
Did you swim all the way here from the Potomac River? You're the real MVP.
Actually, no, I had to stop in Sparkletown so I could match with these jackets y'all have. So here we are. However, I did find that hammer y'all sent for me. In fact, I think he's here with something exciting to share.
Hello. Sorry to crash the party here, but I wanted to ask if I could actually present the pitch of the day, knowing that, again, this is my baby, guys, so I don't know if you could say no to that. What do you think?
We would love to have the flounder of Shark Tank join us to present the winner.
I saw that. That's, I guess that's a great fish, right? Flounder.
Excellent fish, the best.
All right. So, drum roll. The pitch of the day is two-step solution to fixing the C. diff problem. Round of applause.
Awesome.
Shark attack. Congratulations. Congratulations. Let's get some photos here, guys. Let's do it. Wait, where are you going? Get in here for the picture. Come on, guys.
Sharks.
Sharks, please. Let's go. Thank you. You can't just attack us and walk off stage.
Careful.
All right. Ready? 1, 2, 3. This time you hold it. It's your award. All right. Congratulations, Lucy.
Congratulations to our pitch of the day winner. Thank you so much, Dr. Elna Hall. Sounds like the audience was really impressed with the presentation Lucy gave today.
And thank you to all of our sharks and finalists who joined us in taking a bite out of innovation.
Make sure to tuna in next year.
Wow, Blaine, that's a really great effort. You're showing some great pun potential.
All right, and scene.
Wait, don't you mean Finn?